Hello, and welcome to Indy Talks, the monthly interview show brought to you by the Hudson Independent, the most trusted source of local news in the river towns. My guest this month is Dr. Sherlita Amler, the Commissioner of Health for Westchester County. She has been in that position, I believe, since 2011. Is that right, Dr. Amler?
Yes, that's correct. My expertise is really in disaster medicine. Before I came to Putnam as the commissioner there,
Right.
and then later to Westchester, I was at the Center for Disease Control in Atlanta, Georgia.
Okay, so you know this game pretty well.
Yeah, I've been preparing for this kind of thing my whole life.
Exactly. Well, here you are. It's unfortunate that you have to use it, but there it is. Good to have you with that expertise. We're in, as a country and as a county, in a pretty dark place right now. We're coming out of the Thanksgiving holiday weekend and 5-day period. We don't yet know the results that I know of what may have happened because of all the interactions and the travel that took place over that weekend. But the expectation going into this holiday period with Christmas and Hanukkah coming up is that it's not likely to get any less risky going forward. So the question is, Dr. Emmer, my first question is, are we running out of options to handle this thing? We're now in a phase where the governor is using his micro-cluster strategy to attack this. I'm not sure how effective it is, but perhaps you can enlighten us on that. But what are the tools left in the box for the state and the country?
Well, I think that we forget the most important tool, and that is that although a lot of people feel that their situation is helpless in this pandemic, that there's absolutely nothing that they personally can do to alter the course of what's happening, that's not correct. Really, the power lies in the people, because it is their individual decisions and what they do pertaining to their own health and their family's health that really will make the difference in this. I mean, it's really not what I do or the governor does. It's really more what the people do. And if they take personal responsibility for themselves and their family, we know that we can get this under control. We did it before. We also know that about 65% of the cases are related to small clusters, small social clusters. So if people listen to the advice that's coming from public health, that's coming from the CDC, that's coming from the governor's office, if they wear masks, if they social distance, if they don't gather in gatherings of, the fewer people, the better. I mean, the governor says 10 people or less, but honestly, the fewer people that you have in your circle, that you have close interaction with on a regular basis, the better. And if people do that, they will protect themselves. And by protecting themselves, they protect others. And that's how we get out of this until we get a vaccine.
Right. That message has been repeated over and over again by yourself, by George Latimer, by Governor Cuomo. It doesn't seem to be sticking all that well. But is it just a process of continuing to repeat that message over and over again?
I think people don't realize how powerful they really are in this kind of an event. And they're, a lot of times they're looking for someone above them to fix the problem, when the problem is really something that we as a society have to take on, each one of us understanding our own part and playing and being responsible for our part of the issue. And like I said, I think, that's where it really lies, because you're right. I mean, in the summer, we had single-digit cases, less than 10 cases a day in Westchester. And then as summer went to fall, our case count started to go up into the 20s and the 30s. And now we're seeing between 500 and 600 cases a day. Obviously, I tell people all the time, if you have no exposure, you cannot get this disease. If I'm home and I'm doing all the things that we've talked about, mask wearing, social distancing, avoiding others, I cannot become sick. I cannot get this disease from the air in my house or from those individuals that, I'm sharing space with, as long as they're doing the same things. So we have to protect ourselves, we have to protect our families, and we have to start taking personal responsibility. And there's no shortcut for that. There's no cavalry coming if you don't do what you're supposed to be doing. And what we don't want to see is for our hospitals to become to the point that they cannot accept new patients, that they have no beds, that they have no ICU beds. That's what we're trying to avoid. And we do need for people to understand their part in this and how important it is.
Right. Everyone seems to agree that we want to do everything we can to avoid another lockdown and a shutdown of the economy. And there are various strategies for doing that, the governor's microcluster being one of them. There are those who say that if you just let the children, who are less likely to get very sick from this, go to school and continue to do their activities, protect the people who have underlying medical conditions, and older people, put granny and grandpa in their rooms and lock the door and stick some food under the door, that if we follow those procedures, we'll be fine. I'm a little skeptical of that. Tell me what you think of that theory and what's wrong with it.
Well, I think we could let Renee talk about the numbers, but the fact is that we know that most of the cases are actually in the like 20 to 40-year-olds. That's where the cases are. And if you look at our schools have done a fantastic job. The positivity rate in our schools is less than the communities they're in. So they're doing a very, very good job. And the children and staff in the schools who become positive for COVID are not catching it in large measure in the schools, but from, again, small social gatherings outside of the schools. And Renee, I don't know if you want to talk about the numbers that we're seeing and what we've been doing with the schools around this.
Yeah, so we certainly are seeing definitely decreased numbers in the school, and I think that's because the schools have done an excellent job on following the governor's guidance around, the social distancing. I mean, some schools have gone into putting different air filtration systems into their schools. They've worked out, creative ways with the cohorting, trying to reduce time, using larger rooms like cafeterias and lunchrooms for classroom settings to be able to ensure that kids are not exposed. So I think they really have done an excellent job. I will also say the schools themselves have been really great at learning contact tracing. I think we've worked with almost every school district in this county. We've sort of tried to guide them through the contact tracing process, and they've gotten it. I mean, so they really have been, sort of a part of our public health army in trying to sort of tackle this. I think to one point of your question is that people need to still be reminded. I think this disease, unlike most diseases, you expect to get sick. There's a large percentage of people who never show symptoms and are just as infectious as someone who has symptoms. And so you may get a false sense of, oh, my younger one is fine, and they can go see grandma, when in fact they may then transmit it to someone who it's going to have a very different effect on. And I don't know if Dr. Amler wants to touch upon what we saw not that long ago with some of the hospitalizations in children and the impact sort of after they were infected.
Yeah, so there is a multi-inflammatory system disorder that children could get, and there have been pediatric deaths. So it's not that children, can't get sick, can't die. It's just that in general, they do better, but they do better with almost any illness. And as far as locking grandmother, the grandmother in the closet kind of theory, these are not the individuals who are getting COVID in large measure. They're not the majority of the cases. The problem with people, even my age bracket, is that we don't do as well as people who are 20 or 40 if we get the disease. We're more likely to end up with serious complications. We're more likely to end up in a hospital, and unfortunately more likely to die. So it is very important that, we do protect our more senior citizens, and especially those individuals with underlying medical conditions that might have a very bad outcome should they get COVID.
And as you say, you have a very insidious disease that may have someone who is infected but totally asymptomatic. But once that person comes in contact with someone who is older or more vulnerable, it doesn't matter. The contagion of this disease is pretty powerful.
People don't understand because we're used to things like measles, where, you have visible symptoms that you are sick. You've got a rash, or you've got a fever, or you look sick. 40% of the people who have COVID have no symptoms at all, but they're still infectious to others. And so that's why it's so very difficult for us, because there's a lot of people walking around out there that think they're perfectly fine when in fact they could spread this disease to anyone they're around and have close contact with.
We get a lot of statistics, and I write almost every day about COVID on the Hudson Independent website. And we have these wonderful maps that the county provides with all kinds of granular detail of what's happening in each community. I'm curious if you could tell us, and Renee, probably you're the best one to do this, talk about the methodology. Where do those numbers come from that tell us that Tarrytown has 54 cases or Sleepy Hollow has 101? Where are the numbers? How do they get collected? How do they get assimilated and processed?
Sure. So what people may not realize, even outside of COVID, there are, close to 100 diseases that local laboratories and physicians are required by law to report to the local health department. And so COVID was added from the governor very early on, or actually through Zucker, state health commissioner as well, to make that reportable. So regardless if it's an antigen test, regardless if it's a typical PCR test, so all those test results must be reported to the state laboratory system. We have access to that data, and that's how we get the case information. So if it's a Westchester resident, it's our responsibility to investigate that case. So from that system, both negative and positive test results are coming out. And so that's how we are pulling out the information. So it's a system that we have access to that really generates all the laboratory information for Westchester residents.
Right. So if someone goes up to Phelps Hospital, for example, and gets tested, but they live in Briarcliff Manor, they're going to be reported as coming from Briarcliff Manor because that's the home address that they give when they put the test?
No, they're supposed to be putting the patient's residence address in there. I know in the very beginning, we did have when we first started with COVID, there was sometimes it was very chaotic. And so in the very beginning, back in March and maybe early April, sometimes we were just getting the reporting lab. But then what happens is when we then go to do the investigation on that, that's one of the first questions we ask people is, where do you live? And if it's something that we found out of our own jurisdiction, the case is actually transferred out of Westchester and is reassigned to another county in New York State, or if it could be another state that is done through the state health department.
Right. So we can debunk the theory that I've heard, and some people around here believe that Sleepy Hollow is being unfairly hit because they have Phelps Hospital there and people are being tested at Phelps from all over the place, but that's not the case.
No, it's by county of residence.
Right.
Case count by county of residence. And that's true for any communicable disease, not just this one. That's how we always do it. And the same would be if a person died in Westchester. We have a lot of hospitals in Westchester. And so, the deaths reported would two ways, by the county of residence of that individual and the hospital location.
Recently, I heard George Latimer in one of his briefings refer to the corridor along Beekman Avenue and Sleepy Hollow as being sort of a hotbed. That's a pretty granular analysis. How did he know that? Is the data that fresh that he can identify just an individual neighborhood?
So we do, because we are getting address, we certainly can pull cases down to that level. I will also say that in our state system that we're using, which is CompCare, which is really where our disease investigation module comes out of, you are able to sort of, again, go down to a more granular level if needed, to look at if there's clusters potentially where someone identified an event over and over again when I've interviewing our contacts, and also potential work sites. So it does allow us to make sure we're not missing potential clusters within our community.
Right.
And all that brings up an important point that I would like to make, and that is when we reach out to people on their caller ID, they may see that it says, New York State, and we would ask that they pick up the phone, because we obviously don't have time to go door to door on this. So when we're trying to reach out to people to investigate cases or to let people know that they possibly maybe a contact to a case of COVID, really important that they answer the phone.
Does HIPAA privacy laws get in the way of this process at all?
Not at all. So if anyone ever read one of your public disclosure agreements, you can go to the doctor, there is a provision in HIPAA that exempts for public health purposes. It's one of the exemptions. So we are always been allowed, even prior to COVID, to speak to physicians' offices, again, to protect the public's health. That is a provision in the HIPAA.
Mhm.
But we don't tell people who name them as a possible contact, because we want the public to feel free to speak to us. And if they thought that, that we were going to say, John Smith told us that he was around you and you might have COVID as a result of being around him, no one would talk to us. So the information that we get is held confidential. And so when we do contact people, we simply say, you've been named as a potential contact to a case of COVID.
The data that you have, I presume, would be able to tell you the age of a patient and lots more about them in terms of comorbidities or stuff like that. So you could really analyze this down to that level, knowing what percentage of people who have the disease have comorbidities, what percentage are in this age cohort or that age cohort. Am I right on that? That you've got?
So
that?
yes and no. I mean, the interview does allow for us to elicit some of that information, but as Dr. Amler indicated, the number of cases that we are experiencing on a daily basis has been growing. So when you have that kind of volume, we have to make some decisions about the prioritization. And for us, again, really key to find out how people may have been exposed themselves to have contracted COVID, and then who they may have been in contact with during the infectious period.
But you're right that later on, when things slow down and we have a lot more time, we'll want to take a look at those kinds of things to learn more about this virus and about this, who it potentially impacts. And so later on, there'll be, I'm sure, a deep dive into all this information to gather as much information as we possibly can, try to learn as much as we can from the information we have.
Right. Talk a little bit more about contact tracing. It seems to me it's a very arduous task and requires a lot of skill. I remember being skeptical when this was first announced that the state or the county would be able to recruit the number of people and with the right skills. How would you assess how that's going?
Well, contact tracing is, again, not a new tool. This is something that we have used for infectious diseases, communicable diseases, ongoing. It's bread and butter to public health. And so you get good after a while at eliciting information from people. It's very important, no matter what the disease is, if it's infectious, that we be able to try to understand where somebody was exposed to a disease and who they might have given it to, because that's how we, stop the spread of disease. What's unique about this is that we're recruiting people who don't do this for a living and now training them to do this. And so it starts with an initial case investigation. So you're talking to the case, you're asking them a lot of questions, a multitude of questions. But part of what you're wanting to know, not just about themselves and their symptoms, but is exposure. And even that can be a little bit trickier than people think, because it's not as clean cut as, were you around anyone closer than 6 feet for more than 10 minutes, because invariably they were 11 feet or they were 12 feet and it was 8 minutes, and and somebody walked through the room, and and so there's all these variables that the person who's eliciting this information has to be able to understand and make decisions in regards to, is this person a contact or aren't they a contact? And it's just not as clean cut and as simple as it sounds.
Interact if somebody's going to the Stop and Shop and wearing their mask, but they're going to be coming roughly in contact with dozens and dozens of people. And I don't know how you ever trace that.
Sometimes you can't. But our job is to try to find as many people as we can, identify them, let them know, so that, because this is the thing about this disease. You have a window of time. The incubation period for COVID is 2 to 14 days roughly. So as soon as 2 days after exposure, you could potentially be infectious to others. Typically, it's more around 5 days. But if you can identify, first, the person has to get tested fast, a rapid test. You want to get the results back in a reasonable amount of time. If I don't get the results back for a week, it doesn't do as much good. So you want to get the test results back fine, as quickly as possible. Know that that person has COVID. Then you have to identify the context. But if you can do so within about the first 5 days and get them to quarantine, you could prevent them from spreading the disease to others. And that's how you stop an infectious process.
So I think one of your points, though, like how do you find people in these larger settings? I mean, so some of the tools that we have used, again, not just for COVID, which, I mean, the worst case scenario is when you really don't have an ability to like get a guest list or a reservation list or an email distribution of, from a place where people may have been exposed. The next thing, if we really feel it's necessary, we will put out a press release, which we have done under COVID, to say if you were at this place during this time or these days and these hours, you may have been exposed. So we do try our best to make sure people who can't be named are notified that there may have been an exposure to them.
Right. Talk a little bit about testing and where we are in terms of the availability of testing and the speed in which we can get results. Are there improvements that have been made over the course of the last 6-7 months in either of those?
Well, when we first started testing, you could only get tested at CDC, and we had to get permission to send the labs to CDC. Then Wadsworth, which is the New York State lab, was the testing location in the state of New York. And then subsequently it was hospitals, and then it was large medical groups, and now it's CVS, and there's walk-up testing, there's drive-through testing. There's a whole variety of tests. There's different kinds of tests. You can get an antigen test, which is looking for a protein associated with the virus. Those are of limited, service, because they have a lot of false positives, false negatives. Then there is PCR testing, which is actually looking at the RNA of the virus, a much more refined test. But in the state of New York, no matter what test you use, if it's positive, we consider it a positive finding, and that's how we'll treat you, and you'll be placed in isolation for 10 days, and we'll try to elicit your contacts. Testing has gotten rather difficult sometimes, especially in the last couple of weeks, because we've had a lot more people wanting to be tested because they wanted to visit with family and they thought this was a mechanism for them to do so. I think the thing to remember is that, and I've said this before, it bears repeating, it's a moment in time. If I was exposed, 7 days ago, I might test positive today, but my test could come back negative today, and I might not test positive for 2 more days. So to say that I got tested, I'm fine, means I'm fine right at this moment, but there's no guarantees about tomorrow or the day after that or the day after that. So it's really not appropriate to use this test to try to visit your relatives or do other activities.
We have a very limited amount of time left, but I wanted to talk about vaccines because everybody's waiting for them. Got a lot of logistical difficulties to face and how those vaccines are going to be delivered. How do you anticipate this is going to happen here in Westchester?
First of all, they have to decide what vaccine is going to have approval. There may be more than one vaccine that gets approval, probably will be more than one vaccine. Once that happens, vaccines will be probably shipped to the state. There may be private entities purchasing vaccines. And, we'll have to be given guidance as to who is eligible to get the vaccine. Initially, there will not be enough vaccine for the entire population. You have to remember that these vaccines are going to require 2 doses probably roughly about a month apart. It depends on the vaccine when the second dose will need to be given. So whatever amount of vaccine you have to cut that in half because every person who gets it has to have a second one. So it probably will go to healthcare providers who are actually caring for sick people. We need those healthcare providers to stay at their posts. We need them to not get sick. So they will probably be in the first round that gets the vaccine. Beyond that, it waits to be seen. And so we'll have to wait for CDC, the feds, the state, to give us guidance around that. And once we know, vaccine may go to the hospitals, it may go to large medical practices, it may go to the health departments. Ultimately, I think you'll probably see it in your local pharmacy. It's just going to take time for them to make enough vaccine, whatever the vaccine is, so that we can vaccinate everybody who needs it and wants it.
Renee?
I would say the one thing people may not realize back in H1N1, I mean, local health departments really were part of a funneling distribution for giving out, a vaccine as well. So, I mean, again, this is not new to us in terms of standing up this kind of, it is a lot of logistics, but we have done it before.
Successfully a couple times. So this is what public health does.
Yep. Well, one of the vaccines, the Pfizer one, apparently requires to be stored in a minus 100-degree temperature. That must fall into your department to deal with. How do you handle? Where are those facilities that you can store large amounts of vaccine at 100 below zero?
Well, certainly hospitals and large medical practices and local health departments were made aware of that possibility months ago. And so, we've all been looking to acquire, get freezers set up that can handle those temperatures because we know, that's a possibility. We're not yet sure what vaccine we're going to get, so it may or may not be an issue. But it's something that we're all preparing for even as we speak.
Right. Who is going to decide which of the vaccines that's approved, and right now we're looking at two, the Moderna and the Pfizer, which one we will get here in Westchester?
Ultimately, it is the Federal Food and Drug Administration that will have to provide an emergency use authorization for the vaccine because they're not going to wait to go through the usual channels. And normally it would take a decade to get a new vaccine through all of the requirements and the testing protocols. So we have to wait to see who the FDA is going to approve, what vaccines they're going to approve. And then, of course, we will be dealing with the CDC, State Health Department, and whatever we get is what we will deliver. We won't know what the results were from Thanksgiving for about another 10 days. And so we're going to be keeping very close eye out and to see what our numbers do following, the Thanksgiving holiday. But certainly people are starting to make Christmas plans and Hanukkah and New Year's. We have a lot of holidays coming up, a lot of holidays where we usually gather. I just would ask everyone to please be responsible because the person who is in the best position to protect your health is yourself. And certainly if you can prevent being exposed, you have nothing to worry about. So just, do the things we've been telling you, social distancing, masking, keeping your group size that you're around small. It will go a long way to keeping everyone well.
Renee Recchia, Dr. Sherlita Amler, thank you for being on.
Well, we thank you.